I think the main reason I like endodontics is the challenge. So having played golf in high school and college, I feel like golf's a very difficult sport to be exceptionally good at, and I think endodontics is exactly the same way, where every tooth is different, every case is different, every patient is different, they all have their own challenges. And in that, part of my competitive nature helps me to overcome those challenges because I don't like to lose, and I feel like when I win, the patient wins.
Everything was patient-centered. So our office is very focused on patient outcomes. It's about doing quality dentistry, quality root canal treatment, and ultimately doing a thorough diagnosis. So for us, we want to make sure we get to the bottom of the patient's problem so that, again, they're getting the correct treatment and the best treatment possible.
You can tell that from the front desk to the nursing assistants to the nurses, everybody really does care about you here. Whenever they call you the next day, I mean, they're not just calling just to knock it off their checklist. They really want to see how you're doing and make sure that everything's working out for you. And it's just all appreciated. It really is.
Once we're finished with their treatment, they will make the comment that they will never have a root canal done anywhere else except in our office. So, I mean, that's like the best compliment ever.
So one of the things we utilize in our practice is a microscope, and the advantage the microscope gives us is we're able to treat teeth more efficiently, and also we're able to treat teeth that in previous years we wouldn't have even been able to treat. The patient would have had to have the tooth extracted. One of the other technologies that we were early adopters of in our practice is the cone beam CT. We take the cone beam CT, we're able to see things that there's no other way to find.
People are invariably nervous about coming to the dentist, and especially the endodontist, because they've never met us before. And there's this notion that endodontics is going to be painful and it's going to be a horrible experience. So we want our office overall to be very relaxing. Our staff is very compassionate when they're working with patients. And then the same thing, once we get the patient back in the chair, we want them to be relaxed. We want them to feel confident in the treatment we're providing and know that we really have their best interests at heart.
You know, I was really nervous the first time I came in here. I'd never had a root canal or anything like that done before. And, I asked a million questions. They were patient, really kind, really helped to guide me through the process and make it to where I had no fear involved.
We try to develop the office to feel as homey as possible. And the good thing about our doctors is that they really do treat patients like family. And they are going to recommend the treatment that they would recommend to their mom or dad or brother and sister. And whether that's a root canal or not, they're going to be honest with you and point you in the right direction.
So we give the best possible care to our patients. And I know this because not only do I work here, I'm also a patient here.
The reason I come to Dr. Davis is I can trust him. I enjoy seeing someone that I feel comfortable with and that I trust that will take care of me in a professional way.
They're very knowledgeable, professional, and compassionate.